Hi, it's another interesting episode of J&J Health Hub presentation. Today, we will be talking about a very common condition, which is sickle cell disease. Stay tuned and let's take a piece of cake home. Okay, so at this juncture, we will dive into the outline of today's presentation, where you will know what sickle cell disease is, the cause of sickle cell disease, the pathophysiology, the signs and symptoms related or associated, complications that may arise, where we will talk about the various crises that we have, and then dive into the preventive mechanisms or adaptations. For sickle cell disease, it's actually an inherited disease condition mostly characterized by the possession of two abnormal hemoglobins. And with these hemoglobins, at least one of them should be hemoglobin S. And we all know the role of hemoglobins. So hemoglobins, as the name suggests, is basically proteins in the red blood cell. That's the basic concept that we should all know. So there are various types of the hemoglobins that we have. We have hemoglobin SS, hemoglobin SC, hemoglobin S, and then that of the beta thalassemia. Okay, they are all various types of hemoglobins that we have, and we should all know that the possession of one normal hemoglobin, that's hemoglobin A, together with an abnormal hemoglobin, so we can have AS, okay, or AC. So one hemoglobin A, which is the A, and then S, which is abnormal hemoglobin. Then we have C, which is also an abnormal hemoglobin. So once that is suspected, or once that combination has been established, we probably call it hemoglobinopathy, and it's not sickle cell disease. For the pathophysiology, once an individual is having the genetic trait, which is the SS, it predisposes the red blood cells to undergo lysis. Okay, now for the normal red blood cell, we all know that it's having a biconcave shape, but that of sickle cell disease patients, or the red blood cell has a sickle shape. Now, the normal lifespan of a red blood cell is about 100 to 120 days, but that of the sickle cell red blood cells is about 15 to 20 days. So once the red blood cells undergo lysis, and then they become sticky, which predisposes them to get agglutinated and then occlude a vessel, leading to the crisis or various crises that we will be talking about in the subsequent slides. That is basically the. So there are diverse signs and symptoms that a patient with sickle cell disease will elicit or will show. So for the symptoms, we have joints and bone pain. So mostly this is common in the vaso-occlusive crisis, whereby the red blood cells, because it is having a sickle shape, they will clinch together, okay, occluding small vessels, hence causing instances of pain. There are instances of easy fatigability. There is pallor, jaundice is also there, difficulty in breathing, chronic leg ulcer. Patients will present to you with chronic leg ulcer, or there are instances of chronic leg ulcer. There will be abdominal pain. and then spontaneous sustained erection without sexual arousal. Mostly this is in males, okay? Those are the common symptoms that they present with. Now for the signs, we have jaundice, pallor, and the pallor we all know as a result of the continuous hemolysis. So there will be instances of anemia, therefore they will elicit pallor. We have hepatosplenomegaly. We have frontal bossing. So you see that their frontal bone will be protruded, kind of. Then we have dactylitis of both the hands and the foot. We have natopathy. So for natopathy, it's a sign, or it's a very peculiar sign in sickle cell disease patients. Then we have growth retardation or delay. Those are the okay. So for the complications, we commonly have this known crisis. So the first one being the vaso-occlusive bone pain crisis. Secondly being the acute chest syndrome. With this one, what happens is, because due to the sickle shape of the red blood cell, so they cling together, and then it might probably occlude the pulmonary vessel, thereby causing instances of cough, difficulty in breathing, and then acute chest pain or sudden chest pain in patients. For hyperhemolytic crisis, there is continuous or instances of high breakdown of red blood cells leading to anemia. Then we have aplastic crisis. With this, it's also a very serious complication whereby there is an infection, mostly by the parvovirus. For the splenic circumcision crisis, with this, the spleen suddenly becomes enlarged, and then it traps most of the red blood cells, thereby leading to lower instances of red blood cells in circulation. Okay, so once that happens, there is anemia. Then we have priapism. The priapism, as we all know, is a long standing erection. Kidney failure, we have heart failure, we have liver failure, avascular necrosis also as a complication. Then we have hand-foot syndrome, and not forgetting growth retardation. So below are some precipitating factors of the various crises. Remember, we mentioned the common ones being vaso-occlusive bone pain crisis, acute chest syndrome, hyperhemolytic crisis, aplastic crisis, and that of splenic sequestration crisis. Now, the precipitants are, we can have cold weather, and once the weather is very cold, it can easily cause the red blood cells to clinch together in the vessels due to the narrowing of the blood vessel, okay, which will then increase the viscosity of the blood flow. You get it? Now we have dehydration. So for dehydration, what happens is that once there is dehydration, it will also cause a reduction in the blood volume, thereby causes an increase in the viscosity of the blood as well. Then we have infections. So for infections, we all know that it will trigger systemic inflammatory mechanisms, and all those cytokines will come in place and stuff. So they will also cause instances of the crisis. Then we have physical exertion, and then the last being the mental stress. If you are being stressed too, it will probably have an effect on your metabolic. Let us talk now about some preventive measures of sickle cell disease. The first on my list is genetic testing for relatives. So with this, all relatives of a sickle cell patient or disease patient should be tested for the hemoglobinopathy. Once that is being detected, it will help them plan towards their marriages and family planning and stuff. Now we have genetic counseling. You have to counsel patients who are already sickle cell disease patients or clients about the condition and as to how they can go about with their marriages and then family planning and stuff. We have career testing. So the careers they need to be tested and then be sure of their status. Family planning, as I said earlier, it's also very important. So once you plan your family with a sickle cell disease patient, it means both of you should know your status. So once that is done, your children that you'll be giving birth to, they wouldn't be sickle cell disease patients. Now we have newborn screening. Every newborn should be screened for sickle cell disease, especially those couples who are sickle cell disease patients. We have adequate hydration. As I explained earlier, dehydration is a precipitant of instances of the crisis. So you have to make sure that you are always hydrated and encourage good nutrition. Eat well. Fruits and vegetables, they are very, very important in all sickle cell disease patients. Then you have to avoid extraneous exercise or physical activities, as it will even lead to instances of breakdown of red blood cells. Thanks for your attention. And J&J Health Hub is looking forward to seeing you participate in our next episode, where we will be talking about priapism, which is a sustained unarousable erection in males. Stay tuned, subscribe to our channel, follow, like our videos, and keep updated for subsequent episodes.